Become an organ donor. Shayne Batie was diagnosed with type 1 diabetes when she was 15 months old. Since then, she received insulin shots daily. When she was 25, doctors discovered their kidneys were failing her, and in 2 short years her kidneys shut down and she was put on dialysis. Due to the shortage of organs and the expense of the operation, it took 8 long years away from her family for Shayne to get put on the organ donor waiting list. We'll discuss more of Shayne's story shortly. There are cases like these I feel everybody should become an organ donor if at all possible. I am a simple, hard-working family man and student, just like many of you out there. I'm also an organ donor. I donate my blood and plasma, and I'm on the list to become a bone marrow donor. The huge number of people in need of organ and tissue transplants and the long wait they often have to endure is a problem that can be solved if more people would agree to become organ donors. The reason to become an organ donor is simple: give of oneself to save somebody else. But myths about organ donation still exist. The more informed we are, the more likely we will be to become donors. My hope is to convince everybody to become an organ donor. The list of Americans waiting to receive another chance at life, or a chance at a healthier life, is astounding. There are over 100,000 people in the United States today waiting for an organ transplant. According to the National Network of Organ Donors, a person is listed for transplant every 11 minutes. If you do the math, that's 130 new people on the list daily. These are more than just numbers. These are real people waiting for organs. As the body fails, the wait for a life-sustaining organ can be agonizing. It would be difficult not to wonder, will I be able to hold on until a viable organ is available? And many do not. The wait depends on several things: medical urgency, blood, tissue, and size match with the donor, proximity to the donor. Race, age, gender, income, and celebrity status is never a factor when it comes to organ allocation. According to the Organ Procurement and Transplantation Network, as of January 2010, there are over 47,000 people between the ages of 55 and 64, and over 17,000 people over the ages of 65 on the national waiting list. This includes approximately 2,000 people from Missouri. There are 1,700 children on the waiting list. The U.S. Department of Health and Human Services report as follows. Each day, about 79 people receive organ transplants. However, 18 people die each day waiting for transplants that can't take place due to the shortage of donated organs. After going over the numbers, let me tell you some of the things a person can do to help. Everyone should consider the reasons to become an organ donor. There's a real shortage in the United States of donated organs today. If more people donated their organs once they were deceased, the miserable wait could be so much shorter. A single donor could save up to 8 lives with an organ donation. For instance, one patient could be waiting for a new heart valve, and another could be waiting for a kidney, pancreas transplant, and so on. A donator's legacy could continue after they pass by saving the life of another. An organ recipient may be a mother with small children to raise, or a child with a lifetime of accomplishments yet to achieve. Now that I've discussed why we should donate, let's talk about some of the myths behind donating. There are many misconceptions out there that stop people from becoming organ donors. I'll go over a couple of the more common ones now. Myth: if I am injured in an accident, the hospital staff won't put forth the effort required to save me if they know I'm an organ donor. Well, that just isn't true. A doctor will do everything he or she can to save my life as their patient. This doctor has nothing to do with organ transplantation. Myth: I would have to be young and healthy to become an organ donor, or no one would want my organs. The quality of my organs will be decided at the time of my death. I may have an unhealthy heart, but that doesn't mean my lungs aren't just fine for transplantation. There have been cases that viable organs have been transplanted from donors over 80 years old. These myths and others you may have are addressed at mayoclinic.com. Search for organ donations. Now that you've learned some of the facts countering the myths about organ donation, let's summarize what I've gone over so far. We now know why there is such a long wait for viable organ donations, and the real possibility that one may not live long enough to get an organ. We have also learned what a huge help it be to the transplantation system with a greater supply of donations. I've also addressed a couple of myths dealing with organ donations. If you want to become a donor, it's an easy process. You can register to become a donor at the Missouri DMV online or in person. It is also possible to register at MissouriOrganDonor.com. So let's not wait any longer to hear more of Cherie's story. After 6 months on the waiting list, she received a successful kidney pancreas transplant. This was 7 years ago, and since that fateful day, my sister hasn't had to receive any more insulin because she is no longer diabetic. Her body regulates her blood sugar normally. I am positively affected by the transplantation system. This is why I strongly encourage everybody to register as an organ donor. Something that takes such a small effort can mean life or death to somebody else. Thank you.